I'd like to demonstrate the anterior sickle for you. The anterior sickle is an instrument that is used supragingivally. There are times that it can be used subgingivally. Remember, we talked about the fact that you have 1 to 3 millimeters in a healthy gingiva, 1 to 3 millimeters. That is free gingiva. So, and when the tissue is very flaccid, you may be able to use this instrument subgingivally if you remember that to keep it very, very adapted. Okay, the first thing we're going to do is take a look at this instrument. It has a tip. So there again, it is a supragingival instrument. If you look, the instrument's handle is parallel to the long axis of the tooth. We want to make sure that we keep that instrument parallel. So we look at the handle and we look at the shank, and that is parallel with the long axis of the tooth. So today we're going to work on surfaces away on the anterior maxillary facial. We're going to start with tooth number 7. The first thing I'm going to do is make sure my patient is in the right position. We're working on the maxillary, so that means the chin is up. We're going to look at our grasp. Remember that the thumb and the forefinger are across from one another with enough room to roll. The side of our middle finger is resting on the shank, and of course our ring finger is going to be our fulcrum finger. It's going to be our beam that we use to keep our fulcrum straight. Okay, so let's work surfaces away, and if I do that, what position am I going to be in? That's right, I'm going to be at the 12 o'clock position. So I'm going to move there. I'm going to palm my mirror and I'm going to roll the lip back. You use our finger for retraction. I've checked my grasp. I have a good fulcrum on the incisal edges. I have a nice straight handle that is parallel with the long axis of the tooth, and the tip lays right in the middle of the tooth. So we're going to activate our instrument. And we're going to turn into the interproximal. Check your grasp. Make sure that all of your fingers are touching somewhere. And continue on into the interproximal. Remember to go about halfway across the interproximal. You'll get the other half from the lingual aspect. Look where my handle is when I complete my stroke. It's parallel with the long axis of the tooth. It's not here. It's not there. But it's certainly straight with the long axis of the tooth. Parallel. Let's try that again on tooth number 9. Check your grasp. A nice fulcrum. My handle is parallel with the long axis of the tooth. I'm beginning my stroke at the midline, and I'm going to go into the interproximal. Just the very 2 millimeters of that tip are adapted. Check your grasp. We're at the distal facial line angle. I'm beginning to turn and into the interproximal. Good job.